Joining me today on NYSE Floor Talk is Sami Inkinen. He is the CEO and founder at Virta Health. Sami, it's wonderful to have you here. Thanks for joining me on Floor Talk today.
Well, thank you, Judy. Excited to be here again.
Again, welcome back. So now, Sami, tell me, how and why did Virta come about, and what exactly do you do?
Yeah, well, quite honestly, my path to healthcare technology and solving type 2 diabetes and obesity was, I'd say, very accidental. And you might remember this. It's now more than 10 years ago. I was actually here at NYSE, taking my previous company, Trulia Real Estate Marketplace, public. And that was exciting.
It was, I remember.
And around the same time, I actually also won world championships in triathlon in my age group. So I was very fit. And so if you had asked me then or around that year, what can be done about type 2 diabetes and obesity? Honestly, I probably would have said nothing, like absolutely nothing. It's impossible because I felt, it's a personal choice and maybe lack of willpower if you have obesity or type 2 diabetes. But what happened to me soon after all those triathlon accomplishments was that I discovered that I was on my way to type 2 diabetes myself, and I already had pre-diabetes. And frankly, I no compute. I could not believe it at all. And then luckily, through two scientists and clinicians that I met who then became my Virta Health co-founders, I basically learned two things that led me on this path. And the two things were, one, obviously I was completely wrong. Type 2 diabetes, obesity is not a personal choice. It's not a lack of willpower. It is a metabolic disease. And secondly, and perhaps more importantly, contrary to what we are told, type 2 diabetes and metabolic disease is actually a reversible condition through nutrition, as long as you eliminate hunger and cravings. And when I learned these two things, I went, this is insane. Like, I have to go and do something about this. Like, we have to try to scale and help millions of people. And so that kind of pulled me into this crazy world of healthcare. And so we started Virta with what I call a crazy mission, reverse type 2 diabetes in 100 million people around 2015. And you asked, how do we do it? Well, it's a combination of telemedicine and individualized nutrition therapy. So that's brought me here.
All right, so now talk to me about your business model and your success to date.
Yeah, so I'd say most things in US healthcare, you have this trade-off. You have amazing outcomes for patients, but it's very expensive for the payer. So there's this trade-off, should we cover that or should we not cover? Well, luckily in reversing type 2 diabetes, it's a win-win because when we reverse type 2 diabetes, get patients off of insulin, make them healthy, the payers actually save a lot of money in the process. In fact, it's specifically $6,000 on average per patient per year in gross savings. And simultaneously, obviously, the patient benefits because you get healthy and you reverse your disease. So this is a very rare thing in healthcare that you have this type of a win-win. So consequently, our business model is we go to payers, large self-insured employers like U-Haul or Papa John's happen to be our clients, or health plans like Blue City, California, or Humana, also our clients. And we go to them and say, cover this treatment because you will make money in the process. So those are our clients. And then the treatment is free for the individual patients that we treat, employees or members of the health plan. So that's a business model, which again, it's a very rare win-win in healthcare where both the patient and the payer wins. And in fact, we're so confident about the results and the outcomes that we deliver that we put basically our money where our mouth is. So 100% of our fees are at risk and our clients won't pay unless we deliver the results. And I think you asked, what's been the business success so far? We started commercialization around 2018. Coming into COVID, we had 30 clients, and now we have 460 large clients, employers and health plans and so forth. And then more than 100,000 patients have now benefited from the Virta treatment, most of whom have reversed their type 2 diabetes and gotten off of insulin. So, but I still think it's like day one for us.
So now, Sami, many now talk about GLP-1 drugs such as Ozempic as the potential magic pill for obesity. So tell me, how do these drugs affect Virta's business and why?
Aren't we all looking for the magic pill?
Yes, we are.
Well, honestly, GLP-1s have been a huge tailwind for our business. But let me give a little bit of a context. Not everybody may know that the first GLP-1s were approved already in 2005, so more than 15 years ago, for the treatment of type 2 diabetes. And in fact, our Virta Health providers have more than 8 years of experience prescribing and managing and individualizing and deprescribing GLP-1s for type 2 diabetes and using telemedicine. So this is not a new thing, this class of drugs, and we have a lot of experience using them. However, like you said, what is new is that now there are a handful of GLP-1 drugs that have been approved specifically for the treatment of obesity, so weight loss. And first one was approved by FDA 2022, I think. And so that has been a huge tailwind, at least for two reasons for us. One, the payers that we work with, employers and health plans, a couple of years ago, obesity was kind of like a footnote, maybe priority number 50. Like, we don't have to worry about that too much. Now, over the last 18 months, obesity, the cost of it and addressing it as a disease has become a number 1 or number 2 priority for all of our clients. And obviously they're looking for companies and telemedicine companies who have experience in this space to help. So that's the one reason. And the second reason is, this is actually both patients and the payers. They're looking for alternatives. They're looking for adjunct therapies. They're looking for off-ramps to these drugs that would be safe and sustainable for the long term. And luckily we have more than 5 years of data showing that you can nutritionally achieve GLP-1-like results safely and sustainably, and we published this data. So these two things combined, it's been actually a very exciting time for us over the last year. And we went, just to give you numbers, about 10% of our clients purchased or signed up for our comprehensive obesity service a year and a half ago, 10%. Last year, 2023, that was 80%. So practically all the payers we work with go, hey, can you help me with obesity? And I think it's just accelerating and growing going into 2024.
And finally, Sami, looking back at your first 10 years, what are you most proud of? And what are you most excited about for the next 3 to 5 years?
Well, not to set the bar too low, but honestly, having started a few companies, just the fact that I'm here with you at the NYSE floor is kind of a miracle statistically. So I'm very proud of the amazing work that has gone into building Virta so far by our team, who's worked tirelessly. But to be more specific, I think the two things that I'm most proud of, first, on an individual patient level, we have multiple patients, not one, not two, not three, multiple, who have permanently tattooed the Virta logo that's behind me on their bodies after we reversed their type 2 diabetes. And so how many healthcare companies are there where the users, the customers are tattooing the logo? So that's incredible to me. And then also I would say, I think we've made disease reversal a thing. And the fact that there's hope for people with type 2 diabetes, that it is not a progressive, chronic, one-way street that leads to amputations and death. I think the fact that we've made disease reversal a thing and made people aware, I'm very proud of that. So that's sort of looking back. Looking forward, I think execution is what I'm most excited about. 70% of American adults, sadly, today, are metabolically unhealthy. So type 2 diabetes, pre-diabetes, or obesity, or many of them. And so I'm very excited to hopefully treat millions and millions of people and reverse the disease again, rather than just treating the symptoms of metabolic disease. So my hope is that in the future, metabolic disease reversal is the standard of care and the number one objective for anyone living with the disease. And I think that's how you change healthcare for the better, for the payers, for the patients, and for the taxpayers.
All right. Well, Sami, it's been wonderful to talk with you. Thanks for joining me on Floor Talk today.
Good to be back. Thank you so much.